being open and trying to be compassionate is our way.
So we're live and you get to start off.
Okay.
Yay.
Yeah, I think being open and compassionate is the #1 way to go.
Absolutely. So hi, everybody. Welcome to our Theta Healing Power Hour. And I am with Maryanne Tranter, and I am going to be introducing her. But just a reminder, we are going to be doing some energy work around critical shifts that parents and children can make to balance and be healthier. And Maryanne, when I met her, I was like, oh, she's got to come be a guest on my co-live, because she's super cool and I love how she thinks, and I'm with her with how she approaches and works with people. So let me tell you a little bit about her. Okay, so Maryanne B. Tranter, she is a PhD and an APN, which and also a pediatric nurse practitioner, and she is the founder of the Healthy Child Concierge. So Maryanne is an expert. She is a PhD prepared, this is a mouthful here, guys, prepared pediatric nurse practitioner with 25 years experience with families from multiple different cultures and backgrounds, which she's going to tell us about that, right? And she specializes in caring for infants, children, and their families, and also works in an elite hospital in the country. So she's on a mission to walk parents through from panic to peace by providing current research and accurate information to empower parents to raise a healthy child. So she is a professor who's teaching nursing and nurse practitioner students. She speaks and consults around the world, and she has been an expert witness, podcast and group interview guest, and Facebook co-live now, and contributes to journal publications as an expert. So welcome, Dr. Maryanne.
Thank you. Thank you for having me. I am excited to be a part of your program, this energy, and hopefully we can all benefit from a few moments together.
Absolutely. So tell us a little bit about, well, first off, I think people need to know, where are you right now in the world, Maryanne?
So right now I'm in Nicaragua. I knew I wanted to, with my experience of the way I grew up and traveled everywhere and taking care of families from all different backgrounds and cultures, I knew I wanted the ability to visit and be a part of different cultures. And so I finished my PhD work when I was looking for a place to do the research. I wanted another country, another culture, and another language. And I found that in Nicaragua. I completed my degree doing research here. And for now, love the Latin lifestyle, love the easy way of life. And if you're going to be quarantined, isn't it nice to be quarantined in paradise? So I am in Nicaragua right now, and I usually work in Ohio at Nationwide Children's Hospital. During the non-COVID time, I go back and forth and work there for a few weeks, every few months.
But we're not doing that right now, right? So,
correct.
So, tell me a little bit about your practice, what you're doing, becoming, a concierge.
Yes. So like you said, I've been practicing for 25 years in primarily primary care. So seeing kids from birth to 21 and all sorts of wellness visits and also sick visits as well. When you go to a primary care doctor, that's the type of care I was giving. The last few years, while I was working on my degree, I started doing my time in the ER in urgent care, seeing more acute, because I couldn't maintain relationships being away as much. And I really missed that. So not that I think that's a broken system, and I really didn't enjoy the time I was spending with my families. The way the health system is set up, I was given only 10, 15 minutes of family. To be able to see what they had and give them information to help their children, and then they had to move on. So I really felt that I needed something else. So that's why I went back for my PhD, knowing that maybe this is going to open doors to be able to practice the way I want. And decided when I didn't find that after I graduated, I needed to make my own company. So I started this last December so I could have that time and relationships with families so we could talk about their child's healthcare needs, the developmental needs. I could help advocate for them in this medical system. And so if their kids were sick, if they had concerns about behavior, they could be in contact with me, and I could be able to be that person to help educate.
And if you don't follow her, you need to, because she posts some, especially if you have children. But even if you don't, I feel like that there's a lot of information, right, that we all have about our health that is really important for us to all know, and just to read, to be able to share with other parents, because parents get overwhelmed, right? And they don't always, I mean, like, who has time, right, to do research when you have children, or to be able to Google? So to be able to, share Maryanne as a resource is an amazing deal. And also, her starting her entrepreneurial adventure, right? So it's just a great. So tell us, what challenges do parents have that you help them solve with? So again, sometimes we're like, okay, so Maryanne's cool and she knows a lot, but like, who would I refer to? So she's going to kind of give you an idea, like who she helps.
Right. So some of the challenges parents face, as you know, like you said, Googling and trying to figure out what information is right about what's happening with my child. There's so much information on the internet, and they might hear anecdotal stories. My kid had this, and they're like, well, does my kid have that one rare thing or not? So you don't know if this is really something that's important or not, and where do you get those recommended practices? So they want people, don't know where to get the information. And then it is unsatisfying for me as a provider for families, because I don't have the time in practice just to sit there and listen. Tell me your concerns. Tell me what you've tried. Let me explain to you why we do the things we do and recommend. Parents know their children best, and we are limited in practice. So I offer the families a time to share all the information. I will go research and do the personalized research for them. So maybe I've had families that want to know alternative therapies, what's in the research, is there anything? Or I have families where there are no easy answers to, for instance, infant colic. And I will help them go through the things that we could be rolling out and what causes it, things you could try, what's in the research and literature. And so I'm able to give them more time and information that they can use in conjunction with that 10-minute appointment they had with their provider, and be able to have it given to them by a professional who can read the research and who also can translate it for them.
Well, and I feel like I don't know if any, again, most people don't. Yeah, I didn't even talk about who I was. I didn't even introduce myself, but we'll catch me up later, right? But my family has a medical background, and I think that that's probably why I just loved Maryanne so much, because I could really understand where she's coming from, and I feel like that's what happens a lot. If you've never met a nurse practitioner, I'm going to tell you that Maryanne just falls like in who they are. And that's why you want a nurse practitioner, because your nurse practitioners are different than doctors. They can do everything a doctor does pretty much. I'm just going to say, Maryanne's probably like cringing in some of the things that I'm saying, but
oh no, no, thank you. It's
but the deal is that they've actually are that type of person, and they're typically that type of training, that they're not just pulling out a prescription pad. And I don't think that all doctors are like this, but it's
right.
unfortunate that the schooling that they get, this is where their training comes from. And let's face it, the older we get, the younger looking our doctors look when we go like to a clinic or something. We're like, are you old? I'm like, oh my God, I remember when I thought like somebody was saying that and they sounded so old, and I actually think it now. But it's like they're not trained on what else is out there. They're not trained. And I feel like that when you look at a nurse practitioner, and especially with our children, right? Because this is something that is, people have a hard time being objective, when it comes to our children and
absolutely.
our children's health, right? So you need somebody that kind of knows all, again, has a medical background, has done a lot of schooling to get that degree and that certification, but also is aware that there is alternative, right? Because some things that our grandmas did, our great grandmas, depending on your age, right? we're valid. We're good.
Yeah.
You know, I do that. I look that up all the time for my dog. I'm just saying, not to compare children to dogs, but she is my child, right? And they work, right? And so it's like, but who has, you know, again, I don't have uh and I'm not going to say I have time, but it's like I have my time's different, right? Than say a parent of a young child who is having a challenge or is just wondering. And there's the good and the bad of Googling, and I
Yeah.
see it with a lot of people, right? Not just, but it's like, I think sometimes we start to make up symptoms, and our children don't do that, right? But parents sometimes maybe will see something that's not really there, or that they've blown out of proportion because they read that it might be, or that it's, you know, kinda, and then they're like, oh my God, they have this, you know? So and it go again, no judgment. I get it. I see it, and I get it. But it's like, that's your nurse practitioner. They want to take the time. They don't want to just come up with the solution that's the easiest and greatest. You know, my mom, again, she looked at me. My mom's a retired nurse, and she said, do you have a doctor? And I said, no, Mom, I have a nurse practitioner. No, you need a doctor. And I went, no, I'm gonna stick with my nurse practitioner, Mom. I'm just saying, because again, I've been around, I am more into integrative healing. Not that there's a time and a place for Western medicine. We all know that. But a nurse practitioner can help you figure that out. When's the time for Western? When's the time for alternative? What are your options? So that, and help you, again, this is what Maryanne does with our children that we hold very close to our hearts. What are your options, right? So that then you can make that decision, because knowledge is power, but it doesn't always come from Googling, right? Because who's the source? And then you have to look that up and everything else, whereas Maryanne takes care of all of that for you. And there's value in that, for sure. For
So
sure.
there's a couple things. One thing I do want to share with your audience is that, yes, nurse practitioners are trained from a wellness model, where our first foundation is wellness, and then afterwards adding in illnesses, treatments, medications, all of that piece. Whereas physicians are trained from an illness model. So I think that that is one basic difference. There are physicians, I think, that do come from a slightly different training. DO, doctors of osteopaths, which are, they practice like MDs, but I have found the DOs I know do come from a little bit different foundation of education too. I really do also think that there are some physicians that might want the time, some don't. They're just like, I've met many that are like, okay, you have this, take this and go. And the time is really clear that there's a lack of trust in everything, not just our professions. There's a lack of trust in almost all institutions. And so how do we get that trust back? And it's really, in the clinic setting, it's hard. I can look at a patient. What are your symptoms? I look at the physical exam. I know what it is. I tell them, and I tell them the treatment. There's no time to tell them why I'm saying all the things I'm saying. And they just have to trust me. And that in practice now is very difficult to do. So I think that there might be physicians that they're just, they maybe they're right most of the time, but still there's a lack of time with this broken system. So I really wanted that time. Regarding Googling and what I think parents, there's a couple of things that go along with that. One is, yes, just like when you have a medication, they list 100 different side effects, because in trials and testings, and everybody is different and responds differently, that you might read this list and maybe generally it causes an upset stomach, but then there's like these really obscure 25 other things that might have happened. And so they're on that and people get scared. And secondly, unfortunately, which is, I mean, I have to pay a lawyer for my protection because malpractice is so strong, and a problem with like being able, you practice defensive medicine, because people, if you say one thing that might not be for their child, you can lose your livelihood. So on those websites, they just include, they don't want to tell direct things because everybody, because everybody's different. You can't look at a person and just Google it. So that's why I wanted to be that person to say, while I don't legally diagnose and treat, I will do all of the research. I will talk about the symptoms. I'll talk about the educate, 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 and tell them all the literature, what the literature says to do. And so it is I think that's a part of it when people look online and say, there's all this stuff, I don't know what it is. Why won't anybody give me a straight answer? It's because every child and everybody is different.
And so, it's like what Maryanne does, right? Is it's not like necessarily, I wouldn't, it kind of is a second opinion, but not, you know what I'm saying? It's giving you some confirmation and validation of what the information that you're receiving as far as like the diagnosis, and giving you options. Would you say that, Maryanne, on what the how to treat? Would that be?
Well, let me give you a couple examples, and I'll say that one thing is, why does telemedicine, why can't it work? Telemedicine can work because while physical exam is really a key to several different, especially acute, high emergent needs, a lot of treatment is from history, what people have tried. And so because of these kind of things, there's so much that can be done with questions and answers. Some of my clients include clients, like I did say, somebody that has colic. There is not a medicine. I mean, there's some things that people can try, but there's not something to get rid of colic. We don't know what causes it. I mean, the truth is, it's been studied for decades and nobody knows exactly. Now, there are some things that cause babies to cry that we can rule out, and that's what I help parents do. All right. These are the things about food additives or allergies that could be. This is the other physical things that you want to consider looking at. And then these are the other issues about environment. So I can go through those things. I also can look into the literature. For instance, a family wanted to know, is there anything alternative? Well, I looked into chiropractic work for infants with colic. Here is the research for that. Is it robust? No, there's some robust research in alternative treatments, but it's not a huge amount. But still, you can go to your primary care provider, I want to try this, or you can decide, based on this article, the literature, this is what I want to do. So colic is one example. I've had families on vacation call me because there wasn't an ER, or their child's pediatrician couldn't get back to them. Do I go to the ER? What can I do now? Where are the things that I need to know about what to do for my child now? So there's that. Or I've had a family that's had a long-term skin or condition that had been trying everything. And so I did go into the alternative literature to see what else is available, because they'd used the medicines that they've been told over and over and it wasn't helping. So I was able to give them a list of, here's the research about what else is available. Because in practice, I don't have time to go into every research for every little patient's need or question. But that's why I did my business, so that I could for families.
And what price do you put for peace of mind, knowing that you have an objective person who's willing to take the time, right? I mean, I just, we're waiting for her to take adults. No, I'm just kidding. But, but again, I'm just saying, and it's really funny because of how I was raised. I think Maryanne and I had this conversation. When I go to a clinic and I go see a doctor, because I was raised, like by a nurse who would actually, we would do teleconferences with my uncle, who was a doctor kind of thing back before it was, and it would be like, so that's how I talk to doctors. Like, these are my symptoms. This is what I know. This is what doesn't work for me. And they'll just be looking at me like, I can't tell you how many times I've been like, so who in your family has a medical background, right? Because most people don't show up like that. And Maryanne is helping people show up like that, because that's how you want to show up.
Well,
I think that at times, I think people, and I think especially once you have children, that people are like, oh no, I'm not just handing over all my power. Because when it's about us, we kind of like do it and don't even think about it, right? But when it's about our children, all of a sudden that's a completely different deal.
Absolutely. I think parents have the most information. That's why I say I want to partner with parents. let's figure out, and like some of this stuff, it could be behavior. How do I get my kid to stop biting? I need to get them to eat better. How do I introduce different foods? What are there, and what I can bring to the table, or how do I get them to sleep better, is I understand the neurological development. And so I'm able to say what is normal. And then I can also be able to give them those tips over the years that I've, for these 25 years of what I've shared with parents that have worked. So I'm really grateful. Each day I'm grateful for my privilege because of my education, my experiences growing up with a supportive family, as well as living around the world and having the opportunity to get an education in the field that I want. And the grace of the families that have given me with all different cultures, sharing their kids with me, sharing what works. And lastly, with my students, I mean, when you teach, you learn so much more again. So that keeps me on my toes too. I'll have students say, now, exactly why are we doing this with our patients? And so it really makes me as a provider reflect as well. This is why, as well as contribute to the, hopefully these students' professions too, about being open for our families. So I am so grateful for all of those experiences that, and like I said, my privilege, my education, so that I am able to serve families and share how do you, with my knowledge of looking into the research, with my experiences. So hopefully, yeah, there are families that could benefit. I totally get that some families just want to go in, get the diagnosis and leave. They don't want, they're okay with that. They really don't have the space and mental capacity or need that. And I understand there are good fits for some people, just like we all want a specific provider for, or a hair colorist or a dentist. I mean, we all have different personalities, and there's so many combinations we can have in the world. So I just know that I can be there for some families that want somebody on their side, want to have me in their back pocket, want to be able to call me or text me when they're having some anxiety about something going on. And I love being that person.
You know, I mean, I think that it's that thing, right? I always say people, you know, you want to get things in place before you need them. Right. And so I think, you know, again, as I'm looking at parents going for peace of mind, knowing that you have somebody in your corner, because things happen with kids like that. And it's nice to know that you've already established that relationship, already have built that rapport, already have that all together to maintain and be consistent and good health for your children, as well as when the red flag comes up or when something happens, to be able to know, you know, on a vacation, in a, you know, right now that's not happening too much for people, right? You like, that's
no, I get enough stuff about I have enough questions about coronavirus, so it's okay. But you know, I think that it's like having, I mean, it's like my family and friends that call me, oh my gosh, my kid this. I mean, it's like having a nurse or a nurse practitioner in the family, where if you have an issue, you call, a text. I mean, that part of I want to be that for families. I mean, not just my own family. I want it to be, I want to be able to expand that. So yes, that's why
well, you know, and that's the thing too, is that, you know, in this day and age, one, we either want to do some things that our families did and with us growing up, or we don't want to do that at all, or we want to do some of it, but we need somebody with some knowledge that can help us do what we really want to do. And people don't live. I mean, if you have, you know, the, uh, I will say privilege of being around your family and raising your children, you know, that's nice. And you agree with everything and you want their opinion on it, then that's nice as well. Even if you're around them, you may not want that. But I'm just saying that, you know, it's having those options and being prepared as things move on, and knowing that what we're doing now is not going to come and be something that's not going to be good down the line for our children, right? Like there's so many things that we've learned throughout history that, you know, we saw, and of course, poor moms are feeling guilty about it, but they didn't know, and that was the information that was out there, right?
Right.
And
And
so,
that's why I want to be there, because information changes. There are new research for coronavirus. There are 7,000 studies released every day. I mean, the amount of research going on is immense. I mean, and to be able to expect anybody to know I try to read as much as I can about any research with kids, but really things change, information changes, what to do and why. And so for research right now, the new research saying kids aren't getting it as much. We thought they're getting it, but not having symptoms. No, they're not even getting it. And when they do, they don't have symptoms, but still that changes so often. And so I think you don't have to, as a parent, stay on it. Having somebody that is in it, your healthcare provider, or somebody like me. And so that's, why and I love being in the research. I love being in the literature and sharing it.
well, anybody hopefully anybody in the medical profession that has that science, wanting to know, like brain. So, and so, yeah, absolutely. So what can parents do, like in getting started and accurate, like up-to-date evidence-based information to be able to care for their children?
Well, I think that making sure that, well, I should say I do have a parent group that I share. It's free. It's a parent group that parents can be a part of and share information with each other. I think one of the things is finding groups that do share accurate information. And there wasn't a lot. There are some, but when you are given some information, question it where it's coming from until you've built that trust in that resource. And
in any area of life, right? But
right. You get some information. Where is it from? What are their motivations for giving it? And what knowledge or experiences they have in sharing that information. So I think that piece is for all parents. When you hear something that scares you, who's saying it and why? And can it be replicated, or is it just one expert's opinion? Because that is, or a small group. I mean, it really is looking at who's recommending what, why they're recommending it, and building relationship with somebody you trust to say, tell me why or why not. This may or not be good evidence.
absolutely. I mean, I think I learned that at a really young age, and that's what I do in my own life. And I absolutely understand that. It's like there are just certain people, and I'm that resource for certain people as well. Like I just had somebody I hadn't talked to in years because she knew I had a clinic who was run by a nurse practitioner. I'm just going to say that's who I hired to have in there. I could have had any medical professional, and it was a nurse practitioner because I wanted my clients to get the best care possible. And she knew that I knew a lot about certain pieces of alternative, equipment. So she was like, and she was so funny. I don't know if you remember me. And so I ended up calling her and we had a great conversation, but it was like people, and but I was a resource for her. Right. And I believe that that's what, again, I can, I'm a jack of all trades. I am a master of some, but not all of them. Right. But it's like, so I think it's important, right, to know who we've built that relationship with and what information we can get. And but that not we can't be everything to everyone. So that's why it's important to find somebody who's specialized, like Maryanne
Or you.
Right, exactly, in our ways, right? Thank you,
Right.
Maryanne. Right, there's always a plug about Maryanne. Thank you, but but I'm
No,
saying,
but yeah, but you're right. Finding who are the experts in what areas and why, and then finding a way to who you can trust in the world. And
because she knew I'm not a rep for any of the, and so and I even said I would look first to see if you could find it used, and you might want to. And she goes, I didn't even think about that, because I was just like, because no, and she was like, oh my gosh, okay, thank you, and then she's like, and I said, and so it's just really, because I did a lot of research on certain equipment. I needed to, because I needed to know what I had in my brick and mortar at the time was what was, and why, like again, when you're talking to your own clients, we need to know these things. So so you're going to give us a resource for your group, your free group. And
yes.
again, what a beautiful place to be able to start out and check her out, just saying, right? And to be able to know like what she offers, the information that she gives. Do you resonate with her? I always say, not everybody's meant to be that person, right? So she
And
can,
I also have,
she can refer somebody else if you can tell her more of what you want, you know, that type of thing. Or she can tell you, you know, if you're like, you're my gal, right? Tell me more about
right.
what you got, right? So that I can be better prepared with my child.
So I think that I want to, so my group will be a free parent group that they can join. I have a free online training about optimizing your child's immune system that's available on my website. And that's a 30-minute training, and it goes through 5 core areas and strategies you can do today so that their immune systems are optimal and strong as we start getting into public settings again. So that's another resource that parents can have. And then you can see if that is something, if it resonates, you want to be in my group, ask questions there, or you want more one-on-one care and one-on-one relationship, that's on my website also. So
We'll put all of this information in the comments below, folks, so that you can share it with people, so that you can join it yourself if this pertains to you. Please feel free to share this, because like I'm like right now I'm like sitting here going, I'm going to tag this friend, you know, because I'm not actively, I'm paying attention, folks, but I'm not actively tagging anybody right now. So, you know, are you thinking of a parent that or grandparent, right, that this would serve them, right? Because grandparents kind of get some things started sometimes. I'm just saying, right?
right.
Just you know, say, you know, you might want to consider this, and then, you know, and then they keep their fingers crossed that their child will want to listen to them, at least in this aspect. So again, any family member that you feel like that would benefit from this, or, you know, family members type thing, not of your family, but say, you know, a grandparent, an aunt, an uncle, you know, parent that would benefit from this, please share it on your timeline, tag them below here, but we'll put all the information. This is, and then I know that Maryanne's, I'm going to guess, is going to share this in her group, right?
Absolutely.
So that they can also see this as well. Because we just want to be able to give, it's all about options and choices. And what a beautiful day and age that we have, that when it comes to this, right, that we do have some options and choices. Is there anything else, Maryanne, that I didn't ask you about that was, she gave me some questions and I kind of went off course a little bit, but I think we covered everything in them.
I think I do want to give parents three small little tips about being in tune with your kids, okay? And having healthier kids. I mentioned this in my own, in some of the training I give about improving immune system, but still, one thing is for helping, for instance, decrease stress in this time, is to give your kids space to listen to them. And so I think that being in a place where you're going to really listen to them at their different ages, whether that be their cues, physical cues for hunger as a baby, being uncomfortable, toddler cues that don't have the language either, where they're having a breakdown or meltdown because they're overstimulated, or your teenager cues where they're clamming up and shutting down, or middle age, school age, any kids. So my first thing is just to give your family and children space, or your children space and opportunity. And 2 tips I give families for opportunity. One is to lay with your kids at night in the dark as you're falling asleep. They're falling asleep, and giving them the time to share where there's not the intimidation. It's a little bit darker. You're there, and they feel sometimes open to talk with you. Also, at adolescents, if they don't want you laying in their bed with them, okay, we get it. But being in the car with them, taking a drive where you both are looking forward, they don't have the pressure of you staring at them, and there's a little bit less pressure, and they might be able to share. So one is being open so you can hear what's bothering them emotionally or physically. Another would be to listen and look for those cues. So not just saying assuming, but looking to see, are they shutting down? Are they feeling pain, or why are they having a tantrum? So that would be, another, way to help your kids be healthier. Look for their hunger cues, look for all those things so that they stay more balanced with their diet and their health and their emotional needs. And last is to model. And for this time with what's going on in the world, with all of the stress of race, the pandemic, take care of yourself as a parent. If you are not calm and you are anxious and you are stressed, which we all are, but taking care of ourselves so we can be that our children feed off of our emotions. And so to be that confident parent for them in how do I take care of you, protect you from this virus, in how can we be open to our differences and support our friends, and also just modeling good health practices, not being on screens all night before going to bed, or taking time to exercise and take walks. And when you're stressed out and anxious and angry, what do you do with yourself? That is what your children will learn to do. So to help, I think that those are some basic things that help the emotional and the physical health of your child, which is being open to listen to them, looking for cues that are emotional cues, but also physical hunger cues, pain, and then also modeling for them.
So those were great suggestions, and it's such a great piggyback for me. I'm like, and we're gonna get, So for those of you, I am so sorry that I didn't introduce myself. I was just so excited about having Maryanne that I just started in with her and forgot all about me.
Thank you, Brenda.
So no, I'm Brenda B. Bailey, and I am the creator of Shatter Your Income Ceiling. And you're probably going, well, what does that have? Well, this is the deal, right? And Steve Jobs said it, you can have all the money in the world, but if you don't have health, you don't got nothing, right? And so we're really looking at being able to give that information to little ones, right? To little people here at a young age. And I often, what I am a Theta Healing Master and instructor, so I get the whole teacher thing. Yes, learn so much from our students. Absolutely. And people can tell me how they think and how they feel, and what we create in our lives is what we believe. Now, that belief or believe, that word gets thrown around a lot. And a lot of times what you'll see out there is people will say, oh, well, just change how you think and you'll change your beliefs. You can do that. And there are many roads to get to changing our beliefs. That would be the long, arduous one. That's really would take a long time. And I'm all about how can we do this quicker, better, easier, painlessly, and permanently. And that's what Theta Healing can do for others. And so what it does is it bypasses the brain, because the brain actually slows us down because there's so much data in there. And like I said, we only use 11% of it, and we stuff a lot into that 11%. And so what that does is it bypasses, because from a Theta Healing perspective, we actually hold our beliefs on a cellular level. We hold our traumas on a cellular level, and those are all relative. I often say, traumas can be like being in a war or a car accident, to and not to throw mamas under the bus, but to like a parent being like 5 minutes late picking them up from preschool, right? It just depends on, again, because we just come in with beliefs, right? And so something can happen, you'd be like, well, it wasn't a big deal for my first child, but my second child, it's a big deal. That's why. And also too, non-forgiveness. And I think that that's one of the big things when we're looking at as parents. Oh my gosh, guess what? You're not going to be perfect. You're going to make some mistakes, right? And here, we're giving you an option to prevent that, right? With Maryanne, but also too, what was then, and that's the past. It's, what did I learn from it? What am I going to do differently? And then just forgive. Now, prayer is beautiful for that. I'm not going to say that any type of, whatever your religious belief is, meditation, prayer, however you do that. When you do it through Theta Healing and you do it at a cellular level, it's like that. And it actually changes very quickly in a very deep way. So whenever I work with a client, they'll be like, oh no, I've forgiven a lot of people. And I'm like, and then we'll have a conversation. I'm like, are they on the list? Are they on the list? They'll be like, no, or I didn't think about that. Or, and I'm like, and sometimes I think we feel a little guilty about who we're being, because I often say sometimes, especially if you're married, right? Like your spouse, you got to forgive them, but also we just have to forgive our children. They're not perfect either, right? And so
we're all human.
Right. And so I think at times that I think as a parent, sometimes we feel guilty that, they've made us angry, or that we, and I always say, in any relationship, it's the little things on a daily basis that cause things to, kind of go south quickly type thing. So, we look at all of that. And I think that first off, And so when Maryanne was talking about the immune system for your child, right, and their immunity, it's about one, possibly, when they were in vitro, right? Was there something that happened, or was there some things going on that caused there to be a little bit more stress?
Or
Like I
like
had
the preemie babies, they go
Right,
through so much.
absolutely. Oh my gosh, absolutely. Did they have to have an operation at a young age? Right. And so they were separate from their mamas. Because let me tell you, I work with adults. I've also worked with children. I work with a lot of children. But this is the thing, even as an adult, I will look at something and say, oh, tell me about, are there any stories like when your mom was carrying you? And whenever I ask that question, there always is. Tell me about your birth. There always is. And I'm
Right.
telling you, there are certain things that you see in people as a result of that happening that I just always know right off the bat. I've been doing this for 14 years. So, and this is what I do for a living. And so I always know, and believe me, that type of stuff as well, believe it or not, affects money for people, affects their abundance. People always want to make it about their self-worth. Self-worth is a symptom of something else, right? And so it's like I do it, but in a different way. I have my own Google, but it's like the Google of the universe that allows me to get information that people are always shocked, like, how did you know that? But it's because, again, when I'm with somebody or a group, I tune in, right? So I always use this, like, for example, like I use this like with parents, because this is the deal. One, if there's something that you're concerned about for your child, I would say, look at yourself first, right? So I always work with parents, and I always really support them in being a surrogate for their children, especially if their children are younger. Once
Mhm.
they're verbal, like I literally had a kid one time that literally sat upside down on a chair. We were like in person, this is many years ago. And I was, because we use kinesiology, we muscle test, and we made it like a game. But he was hyper, he was, and this was part of the problem of what was going on in school for him. And it was like, I met him where he was. I didn't look at him and say, you got to sit still. We did the session in the way that he needed for us to do the session. And it was very successful. And what's always so funny is that I will have parents that will call me, especially with behavioral issues at school. And they'll be like, can you have a session with them? And I'll be like, sure, of course. They'll be like, do you have sessions with children? Yes, all the time. Now, if they're nonverbal, it's a session with the parent. I'm just going to tell you that right now. So whether they're autistic or whether they're younger, and they're not as good at like saying you could be a surrogate for them, we can do that, right? And so, but it's always so funny because I'll hear like say like there was an issue, and we had a session, and then like they'll go to school, like they'll be over the weekend, they'll go back to school on Monday. Like I can't tell you how many times like a teacher or principal or somebody, whoever like addressed it with the parent to begin with, will go up to them and be like, oh my God, thank you so much, whatever you did worked, and I'm so that this happened, and then came back so different, and thank you for being such good parents. And like literally the parents are like, I don't do nothing except let them have a session with Brenda. And they just found value in that because, and sometimes especially teenagers, I'll just say this, Maryanne's right, they don't want to talk to their parents about certain things. I have another parent, they're divorced, right? And so when he has his teenage daughter, right, when he had his teenage daughter, he'd be like, Brenda, I need you to have a session with her. And I usually had a session with her like maybe once or twice a year. And then it was able to bring him in and say, okay, this is what we've worked on, right? Because again, he's her parent, and I'm going to let him know what's going on, and just say, and this is, what came up as a result, and this is what we're doing, and this is what they need from you, right? Again, we all need advocates in whatever way, shape, or form. Maryanne just has that one that really is with our children, and as far as their health, which is just wonderful. So we're going to do a little work, right? So Theta healing is just like a meditation or a prayer. Just to let you know that the reason it's called Theta healing is because as a practitioner, I go into a theta brainwave. So right now we're in a beta brainwave, right? We're talking. So again, you can Google brainwaves, look that up if that's something that really, my scientific ones like to do that, right? So I'm always like, okay, you can do that. But we really just want to do a little bit of work. It is a verbal agreement. So you have to say yes in order to get the work. And what that does is it tells the universe, it tells our brain, it tells whoever you believe to be your higher power. Mine happens to be God, but whoever it is for you, like, I want this, right? Like, yeah, let's do it now, right? So I always make sure that people have 3 beliefs in place. People are children, whoever I work with, clients, right? Clients, new students. And it's, I want an instant healing. I deserve an instant healing, and an instant healing is possible because what I do is very quick. And if those aren't in place, it slows it down. And, you know, the reason most people are hiring me is because they want a quick, permanent solution, right? So, Maryanne, would you like those? You can say yes, and then anybody else can follow her on that.
Yes, yes, and yes.
Okay. And I'll tell you, I'll share something that I probably haven't ever shared in another one of my lives is I became a Theta Healing instructor because honestly, in my mind, I thought every parent in the world ought to learn this. Not only to heal themselves, but to be able to look at their children. And there are certain things that can just be done, you know, that you can help them with and help them in solution. I can't tell you how many clients and students I have. Like, I have one that her 5-year-old says she's going to be a Theta healer when she grows up, right? Because her mama uses it on her and she sees the value of it. And I think that that's adorable. And her mom taught her like how to do, because kids learn so quickly, right? And I even have like another client that sends all of his teenage children, once they become like sophomores in high school, he sends them to classes, right? And I can tell you, like, college was easier for them. What they chose to do with it, like, and how they implemented it, because again, I just give you basics, was because, oh my God, kids are so brilliant. So, you know, it's just, it's always so much fun to do that. But that's the thing, is that I always say, you know, like when Maryanne was saying, you got to put that air mask on first in an emergency, right? So one, we want to go ahead and just forgive ourselves. Forgive ourselves for the mistakes that we've made as parents. Forgive ourselves for choices that we've made that maybe we weren't aware of, to do it differently. And because we want to be able to open up that space to do it differently, right? To ask Maryanne to hire Maryanne, to be able to utilize her and know that, well, I didn't know she was available last week, right? So we forgive ourselves for not having that information. We also want to forgive ourselves for possibly over the times that we've overreacted, right? Due to misinformation or projection, however that is. So if you'd like those, all you have to do is just say yes.
Yes, I do.
I used to have, or I still have a client and student that I, many years ago, would put out these, back in the day, CDs. I would sell CDs that would have certain meditations on them, right? With Theta Healing meditations. This will, you know, that's how long it's been. And she would purchase them. And she was a preschool assistant. So during their nap time, they would play them. The kids would actually sleep better. But she also played them for her grandchildren, because during the summers she would take care of them, and she'd be like, oh, we're going to listen to Brenda on the CD, you know? And so I'll never forget, like, her granddaughter's probably like 14 now, but she must have been like 5. So the first time that she ever like physically met me in person, because they live here in San Antonio where I live, and she was like, this is Brenda. And the little girl looked at me and she said, Brenda in the boombox? Like, that tells you how long it's been, right? Because, and she really seriously thought I lived in the boombox, right? Because that was what she knew with my voice. That was what she knew. So these are, you know, these are different ways, right? And these are tools, right? So like when Maryanne's telling you, like, you know, go outside, go for a walk, take your children, you know, out. These are the types of things that we expose them to as far as self-care. And, grandma was exposing them to another way to relax and to be able to be calm. So again, I have a free MP3 that I do. It's for abundance, but I always say it's about intention. So, and you can, again, sub in, right, whatever else you would like to do with it. So let's go ahead. Let's see. Let's change what prevents us from being in the moment. Because I feel like that in order to be able to pay attention, and I don't mean it like, because we've got a lot going on. So I never, ever, ever want anybody to think that we're all doing the best we can. But when we talk about following clues, when we talk about listening and giving space, we have to be present. We have to be able to pay attention. Like, like that's the foundation for it. And we want to, I don't know about Maryanne, but like, I was raised where, and again, you're raised by somebody who was probably raised like how I was raised. I'm just saying, that children were, not to be heard, right? And that's a generational deal. That's not like, again, no judgment, but we want to remove, we want to change like what prevents us from listening to our children and the way that works for them. I think at times, like Maryanne gave some wonderful tips, but like, you want to sit them in front of you and you want to look at you. Like one time I had like a client that brought in our son because he was like doing bad in a subject, right? And she was very concerned because he was a good student. And, he had a session with me. And then at the end I said, so what's the deal with your instructor, with your teacher? And he said, oh, we got a new teacher, because all of a sudden it changed, right? Oh, she went like on maternity leave or something. And we got a new teacher and she doesn't listen and she's really hard on me. And it was so funny because it never occurred to her to ask if anything had changed in the class, right? And again, no judgment. It's sometimes we're too close to the situation.
Right.
And that's why we want a professional, right? Like Maryanne, to be able to say, because again, our babies, it doesn't matter what age they are, right? They're our babies. And we want, and so we get those blinders on and we're not able to help them as well as we can. So we want to go ahead and change what prevents us from being able to listen to them now, right? Forgive ourselves if we didn't put it on the list before. If that was a mistake that we've made, like forgive ourselves for that. In parenting, we do a lot of forgiving, right? I'm just saying it's just the nature of the beast, right?
It's a learning.
Absolutely.
It's a process of learning. We're
right,
all learning.
Right. That's what they're saying. Does that come with there are manuals, but like who thinks, like, and there's so much more information out now, maybe too much in some ways, but it's like they weren't around. And I promise you, let's go ahead and let's change the ways that we were parented that we see that we're doing and we don't want to do, right? Like let's break those cycles, right? So let's change the obligation that we have to be in that ancestral cycle of how we raise our children. There's some things that they did that were really good that we're going to do. There's some things that we want to shift because in this day and age, it's not relevant. It doesn't work anymore, right? And there aren't, unless they like live under a rock or something, to have a child not have an opinion in this day and age once they can talk. I'm sorry, we've given that leeway. And that way it is kind of like, it would be so much better if we didn't hear them. But, but we got to balance it, right? And then we also want to, we want to change what prevents us from modeling what would be for our children's highest and best good. Right? I mean, there's the incentive, right, to do it differently. So let's go ahead and forgive ourselves when we, not doing it differently, and we can choose to do it now. And let's change what prevents us from being able to do it differently. Because you can pivot, right? We're all having to pivot, but we can pivot in so many areas of our lives, right? So let's change what prevents us from pivoting. So if you would like that, just say yes out loud. Maryanne, is there anything, I know you kind of gave me a few things that we, would want to cover. Do you feel like that, is there something that you feel like I've missed or that I could expand on?
No, I think that I was able to give those points at the end as a few tips for families. And I am grateful for the space to be able to share how I want to serve the world and how I want to serve families. So thank you for that.
Absolutely. Anything that you feel like that I can do as far as beliefs, traumas, or non-forgiveness that would be relevant, would be good in this conversation that we've had in this moment?
I think for me and for other parents, knowing that we all don't have the answers, but the answers are within us. So I think confidence in being a parent, I think it partially is forgiveness, like many times and different things we've been exposed to, but we have it in us to be, especially when we're coming from love and wanting the best for our kids. So we might not have all the technical answers or might be a little bit lost, which is why we use our village or use our community, use our resources. But I think it'd be important. I don't think it is important that we all have confidence in ourselves. The answers are within us and our parenting is there.
So good one, Maryanne. So we want to, again, forgive ourselves for not listening. So we can call this our intuition. We can call this our knowing, right? So we want to forgive ourselves for not having all the answers. We want to change what obligates us to have all the answers, right? Because we need to know when we have it in our knowing, because our knowing sometimes would be like, call Maryanne, right? Or it could be, like I know. And we want to change what prevents us from trusting our knowing. That's where confidence comes from, right?
Yes.
And trusting our knowing.
And whether that knowing be, I know the answer, or I know where my limitations are to get support, but still as a parent, trust that knowing.
Or I know where I can get the answer.
Yes.
Right. So, I mean, again, right. So that's why we want to, nobody expects anybody to know everything about anything, right? Like ever. But I think all of a sudden somebody has a baby and all of a sudden they expect that they're supposed to know everything about being a parent. Good luck with that. So, so that's why we want to change it to where things can be open. And we also want to change what prevents us from being calm in a storm, right? Because we have to have balance and calm because our kids are feeding off of that, right? I always say, like, back when we were physically networking, and even in the last year, many, many years, I haven't done that. But when I used to do it, I can't tell you how many women would want to, sit down and have a one-on-one with me. That's what we called it, like where they wanted to talk to me because they wanted to tell me about their spouse and how they needed to come and see me. And I'd be like, the world is our mirror. And maybe you ought to have a session and then see if he still needs one. So I'm going to tell you that as well, right? Again, I can help your children, but I can also help you. And I can help you and modeling, being however that is, in order to be that, because you're that energy field, right? That they're either doing the same as or repelling against, right? So we want to be that one that they're doing the same as if it's good, right? So I just probably rattled off a few things. Can we go ahead and change those? Yeah.
Yes.
Now, I just want to go ahead and just go on record to tell y'all that for the first time ever in the history of 20 years of Theta Healing, that they're allowing us to teach virtually. We've never been allowed to teach the Theta Healing technique virtually. Like it was a big deal. I had to re-sign a contract and everything, right? And so I do have a class coming up at the end of the month. I'd have to look at dates here. Because I just am like, okay, Brenda, you got to start making this announcement, the 26th, 27th, and 28th. So if that's something that appeals to you, please let me know. If you want to know a little bit about my Theta Healing, like how, again, what's your situation? Tell me what it is. I can tell you whether or not it can help. Or I'm kind of like Maryanne as well. If I can't, I can tell you who can, right? And it might be that I'm going to go back to Maryanne. I was kidding. But I have a website, www.chatwithbrendab.com, that you can just schedule like a little half-hour chitty chat with me. If that, you know, if you want to just have, if you want to have some questions answered, or why would I want to do Theta Healing, or, you know, anything like that, or tell me more. I'm happy to give you some, I love to give information as well, so that people can make empowered decisions. And then that shatteryourincomeCeiling.com, that www, that's where you can get the free meditation, right? And it's 1 minute, 1 minute. So we're not talking like you gotta, you know, turn down the lights and sit on some soft pillows. If you want to, that's great. But, you know, I know busy lives of parents, that's, you know, the reality is. So I'm all about like, how can I fit this, you know, like, how can I make this work for people? So, you know, there's a lot of different, and we'll post everything down in the comments below. And I'm sure that when Maryanne posts it in her group, she can just copy and paste and put all of that there. So make it a little bit easier for her. I'm guessing it's a private group, right, Maryanne?
It is a free private parent group, right?
Right. So it's not like, you know, public, and you'll be able to see it like if you, you know.
No,
so.
it's just families that are, it's the Healthy Child Community for dedicated parents. I want parents that really want to participate, that want to really be a part of something that has that information. So yes, it'll be in that group if you are interested in joining that. So I'll have that.
So we'll put it all in the comments below. I really appreciate everybody. Please share this with any parent, anybody that is around any children, you know, like I said, grandparents, aunts, uncles, you know, instructors, teachers, you know, please, you know, share it so that they'll have, again, another resource, whether it be Maryanne or myself. It doesn't really matter. So Maryanne, thank you so much.
Thank you,
I just really
Brenda.
appreciate you. And so next week, and then I will go off of Facebook Live so I can have a conversation with Maryanne one-on-one. We're going to have Toy Penny, and she is working with those boss ladies and helping them with staying focused, not being overwhelmed, right? In a lot of areas we have that, and being healthy, making good choices to stay healthy. So so many resources to help people. So again, thank you for joining us, and I'll have a better descriptor and everything tomorrow on Toy so that you can know what to expect in that co-live. It'll be same time, same place. So thank you again for joining us.